And now we're starting to slide back to where we were in 1987, and we certainly shouldn't allow that to happen. The fact is, Ontario's long-term care facilities are 99.9% of the time full 100% of the time, or they're 99.9% full 100% of the time. And that statistic certainly rings true in my riding. For example, in the North Simcoe-Muskoka catchment area, which is huge, it runs from Maxwell and Feversham all the way over to Brechin and up to Penetanguishene and Huntsville. And in my riding, it includes Collingwood, Clearview, Essa, Springwater, and Wasaga Beach. There are 1,700 people waiting on the list for a long-term care bed. If you live in Central Region, which is also huge, it runs from Glencairn down to Huckley and Woodbridge and over to Markham and up to Keswick, and in my riding it includes New Tecumseh and Adjula-Toserania. In this catchment area, there are 2,225 people on a list for a nursing home bed. And while those are some pretty astonishing waiting lists, they don't necessarily reflect the true picture of the waiting lists at my local homes. So let's look at Simcoe Manor in Beaton. There are currently 124 people waiting to get in there, while another 85 are anxiously awaiting admission to Good Samaritan Nursing Home in Alliston. Looking north to Collingwood, there are 108 individuals on the waiting list at Bay Haven, and there's a minimum of 45 people in the same boat trying to get into the Collingwood Nursing Home, and another 45 waiting to get into the Stainer Nursing Home, and an additional 60 are attempting to get a spot in Elmville at Sarah Vista. Over in Grey County at Aaron-Rung Nursing Home in Thornbury, there are 8 people waiting for a bed, which may sound low until you consider that that's a waiting list of at least 3 months. And while these numbers are always fluctuating, in Grey Bruce alone, there are about 300 people waiting for a nursing home bed, either just to get in or for a more private room, which can translate into at least 6 to 12 months waiting times in the Grey Bruce area alone. And it's not that these nursing homes don't want to expand and provide more beds. They do. One local home told me they could easily double in size and still remain full, but each time they try to get additional beds, they're turned down. One home even told me they tried to enter into an agreement to assist area hospitals by alleviating their alternative level of care bed issues, and they were just ignored by the ministry and given the feeling that they need not bother to even try to help out. So, Mr. Speaker, you can see that if we don't increase the capacity locally, we're going to continue to have individuals that are in alternative level of care beds in hospital. They used to call them bed blockers. Through no fault of their own, these people will still be stuck in hospital. I understand there's some 450 in my riding that are stuck in hospitals. That also includes Barrie and Orillia hospitals that are just outside of my riding but serve my constituents. And this isn't good for those elderly people, most of them very, very elderly. They don't get any program in the hospital because the nurses don't have time to play bridge with them or socialize with them. They're literally stuck there in many cases without the programming that is available in our nursing homes and the tender loving care that nursing homes are so wonderfully known for in this province. If we don't get help soon in my riding, and this debate in principles for everybody's riding here, so I hope you'll support it, people in my riding are going to continue to have to try and get into Orangeville or Newmarket or Markham or Huntsville, and that's clogging up someone else's riding. So we need to build new beds. It's a serious, serious matter. It's becoming one of the largest issues in my riding. It certainly was in the campaign last year, and I pledged to do what I could, and I've been doing it quietly behind the scenes and talking with the ministry and writing the minister so far to no avail. We'll conclude by imploring the members of this House to support this very simple resolution that merely calls upon the government to act on behalf of the seniors in my riding, and as I said, the seniors in your riding too, who are growing increasingly dependent on the services funded in part by the province to allow them to live with comfort and dignity in their elder years. Mr. Speaker, let us resolve today to do our best as legislators to bring hope to those on the waiting list for long-term care beds who need our help and are asking us to do the right thing and support this resolution. And so I implore all members to set your partisanship aside, to build some nursing home beds. Since the 20,000 were built or started construction and under our government, you will get up, I'm sure, in your debate and claim 8,000. I heard that in some debate last week. Those are beds that Elizabeth Whitmer announced as Minister of Health. You were just finishing off what we had already announced and started to build. You've not been able to claim any new builds for yourself. Get up today, support this resolution, encourage your Minister of Health, encourage your Premier, encourage your Finance Minister, even though it's tough times. The elderly deserve our support. They need to be a priority. I said even if it is tough times, you still have a record budget of $98 billion, up 26% since you came to office. Surely that money should have been put into long-term care beds and dignity and respect for our elderly.
Thank you. Further debate.